Thank you. I now recognize my friend and 49ers fan, Mr. Thompson.
I'm going to enjoy that steak you're going to buy me after the Super Bowl, Mr. Chairman. Mr. Chairman, thank you very, very much for this hearing today. It's timely and important. Prescription drugs is one of the things that I hear the most about from my constituents. And as we all know, when you need a drug, you need it, and you need it fast. The price of the drug is only part of the battle. It has to be affordable, but it also has to be accessible. And the witnesses have all made that an important part of their testimony. And they all seem to agree that fixing current and preventing future drug shortages requires both transparency and stronger supply chains. Dr. Garlow, I think many of us on both sides of the aisle are frustrated at the lack of transparency in our healthcare system. Can you talk a little bit more about how increased transparency would help in this specific area in preventing drug shortages and ameliorating the ones that we already face?
Thanks for that question. There is a severe problem with transparency in where the raw materials come from, what the manufacturers are doing. We know which manufacturers the FDA has approved. We can get, but it can be complicated to understand what % of the market each of the manufacturers are supplying and where each of them are getting the active pharmaceutical ingredients. That is not really known. So for example, what happened with the cisplatin cases, the active pharmaceutical ingredients made in one plant in India, that plant was shut down by a surprise FDA visit that found some major quality problems. We did not know, there was no transparency that that company supplied the majority of active pharmaceutical ingredients for all of the manufacturers across the board. Knowing that up front, we could have reacted much, much sooner. And it wasn't until we saw the implications of that with now drug dropping from most of the manufacturers that we realized just how much that one plant impacted everyone.
Well, I think it's a good spot for me to ask you and any of the other witnesses that would like to comment. What specific things can Congress do to make pharmaceutical supply chains more resilient?
I think a better early detection system, which relies on exactly your initial question on transparency on what comes from where, early notification when there's a problem so that we can react, we can maybe gear up with some of our manufacturing. We could even look at sites to the FDA to approve manufacturers who aren't currently approved to bring in lots, for example. So a better early detection system. What Congress can do is we are going to have to pay more money for these drugs, these sterile injectables that are generic, that cost, this bottle of water costs more than some of them. We are going to have to, but that's going to be an exchange for resiliency across the system, good quality manufacturing where the
So
plant is
in your
changed out.
testimony, you had mentioned the generic drugs, and the appeal to those for many is in fact the price. But at the same time, that discourages manufacturers because they can make more money in other than generic. How do we fix that?
So that was to me,
Well,
everyone.
I'll ask that to anyone who wants to jump in.
I mean, I could offer a comment, sir. Thank you.
Please.
I think it's important to remember that the vast majority of generic medications are in strong supply, and we don't have an issue, and the market works very effectively to balance cost, quality, and access. There is a subset of complex and inexpensive and therapeutically important molecules, largely generic sterile injectables, that make up the vast majority. I think 2/3 of generic shortages are in the category of generic sterile injectables. And I think that is an opportunity to inject some of the ideas that we've heard from the panel today that are really consistent around transparency and economic stability and incenting additional capacity and supply and thinking about buffer or safety stocks for those subset of molecules.
Yes, sir.
You know the saying, if something seems too good to be true, it probably is. So if somebody's offering to sell you a vial of medicine for 40 cents probably have to wonder, am I getting a really good quality drug? But right now, the system drives providers, purchasers, to chase that to 40 cents, and if they can get it down to 38, they go there. I think we have to take a step back and say, we're going to pay you, so at least some share of your purchasing is not price insensitive, but it also takes into account some knowledge of the quality and the facility where that drug is coming from.
Thank you. I yield back. Go 49ers.
We'll see about that.